Thank you, Dr. Jatinder Bali, for making me part of your prestigious instruction course. I'm going to talk on teleophthalmology and artificial intelligence in glaucoma. We all know this. Glaucoma is irreversible and progressive loss of vision due to damage to retinal ganglion cells. While early intervention could minimize the risk of vision loss, its asymptomatic nature makes it difficult to diagnose at earlier stage. So it's a multi-modality approach that is heavily dependent on the experience and expertise of the clinician. So this is what WHO definition of teleophthalmology. And what are views about teleophthalmology? AIOC survey done assessed the attitude of ophthalmologists in India towards teleophthalmology, and it predicted a surge in integration of teleophthalmology into the practice. There were 1,180 participants, of which about 18% were already using teleophthalmology. 99% showed interest to incorporate it into their practice, and about 99% were interested to adopt a mobile app-based teleconsultation. And the modes of consultation can be either video, audio-based or text-based. These are the various projects which Dr. Bali has already covered. These are the projects in India. Now let's talk about teleophthalmology in glaucoma. The key metrics for diagnosis and progression are, as we all know, intraocular pressure. Yes, OCT imaging can be incorporated in the visual field testing, and all of these diagnostic modalities can now be performed using portable devices by even patients sitting in the comfort of their homes. Regarding IOP measurements, yes, Goldman applanation tonometer still remains the gold standard. But now we have portable IOP measuring devices like eye care tonometer, iMate system, which is a wireless implantable IOP sensor, the Triggerfish Sensimed, and all these devices provide more than a single data point of information throughout the day and allow the patient himself or herself to play a crucial role in his glaucoma care. Optic disc evaluation. Mobile phones can now capture high-resolution fundus and optic nerve photographs using adapters, and these are the various devices: Eye Examiner, InView, DI, iScan OCT, and Envisu C2300. This is a handheld OCT system which is approved by the FDA for aiding in the diagnosis of glaucoma. Visual field testing, standard automated perimetry remains the gold standard, but it has to be performed in office setting. But now we have computer software and virtual reality tools which can offer home perimetry, and these devices are IBIS Vision, Crute Medical Systems Perimeter, which is a head-mounted device, Vivid Vision Perimetry, which do not require a computer, and it's even easier to perform perimetry at a remote location and in a portable fashion. So in conclusion, teleophthalmology can cross geographic and financial barriers that limit patient access to glaucoma care, and it promotes a co-management model between the patient and doctor for identifying, treating, and halting an often a potentially devastating blinding disease. It also gives patient an important role in their own care, so it can improve compliance, and reduction in office visits and time spent in the doctor's office will relieve a burden on the healthcare spending, decrease hours in the waiting rooms, and it addresses glaucoma with a team-based approach, including the patient and the physician. Talking about artificial intelligence, I'm sure this has already been covered. These are the various, it can be classified into two categories: machine learning classifiers and artificial neural networks. Machine learning is capacity of computer to learn from experience, and algorithms learn on their own by trial and error without being explicitly programmed the steps to do a task. Whereas neural network is a computer system modeled on the human brain and nervous system, and it is built as a network of neurons communicating with each other with multiple inputs which modify the output. So there is a feedback loop for learning. So this is input, like the fundus images are taken, which goes through the hidden layers, and we get the output. Like it shows if we have the optic disc images, retinal peripapillary images, then it goes through the hidden layers, and the output is given whether the glaucomatous optic neuropathy is present or not. Deep learning is an advanced level of neural network, and it uses multiple layers to progressively extract higher level features from the raw input. So this machine learning can involve both supervised and unsupervised methods. And if we compare machine learning with artificial neural network, you will find that the machine learning are the clustering algorithms that are extension of classical statistical modeling, and it processes inputs and provide a specific output that serves to classify or grade the input. Whereas artificial neural network these are biologically inspired algorithms that pass the input data through series of interconnected nodes, and the weight of each node is then modified to obtain the desired classification. And if we see the machine learning characteristic, supervised learning uses fully labeled data, whereas unsupervised learning uses raw unlabeled data. So this machine learning is well suited for handling low dimensionally numerical data such as simple numbers like vertical CD ratio, intraocular pressure, age and sex, whereas artificial neural network is well suited for exploiting high dimensionality data through interconnected levels of data abstraction, and it uses data like fundus images and OCT images. So machine learning characteristics uses simple numbers, whereas artificial neural network uses high dimension data. So this is what has happened. There is extraction of features which goes through the feature map, and the common features are pooled, which goes through connections and interconnections, and then multiple repetitions and multiple layers will yield a final output regarding presence or absence of glaucoma. So several artificial intelligence techniques have been proposed to help and diagnose glaucoma by analysis of functional as well as or structural ocular images. And goals of artificial intelligence in glaucoma is either detect glaucoma, or to detect progression of glaucoma, or to study risk factors for glaucoma and quality of life. Prediction of IOP trends from previous data and medications would be useful. Use of artificial intelligence, like using data from 24-hour monitoring of intraocular pressure at home by Sensimet triggerfish. So this is how the fundus image has been taken by a device by Netra, and then which uses artificial intelligence. These images are transported and then they can be analyzed. And the optic disc photography can be used to find out the disc size, vertical CDR, horizontal CD ratio, and disc damage likelihood score, which can help us in presence of glaucoma and also classification of the grade of glaucoma. Artificial neural networks, I've told, is used for classifying optic disc photographs. Deep learning, it extracts glaucoma related features from fundus color photographs, and these are the various studies like that of Ting et al. And which have used the area under curve, and which have yielded a specificity of about 87% and sensitivity of close to 96%. But the disadvantage is in having the false positives, like the false positives in physiological cupping, or false negatives as in patients of high myopia. So these are the various systems like Pegasus, Netra Artificial Intelligence. There is Indian startup which is Kalpa Innovations, and all these parameters can be used to identify or presence of glaucoma. Visual fields, if we take into account, the first use of machine learning is to discriminate normal and glaucomatous visual fields. In 2004, the visual fields were classified independently through unsupervised machine learning characteristics. Pre-perimetric glaucoma diagnosis can be made, and by using combination of TD plot, pattern standard deviation and mean deviation, we can have a forest classifier attained area under curve, and this can be done then. These are the various studies where they have used artificial intelligence for visual fields by Brigatti et al., then Wen et al., and there was subjectivity which was involved in obtaining the visual field data, patient factors, there was measurement noise, and the fixation losses which could make the higher fixation losses which could make the data unreliable and interpretation of visual field difficult. These are the series of studies which have been published for artificial intelligence for the diagnosis of glaucoma using the functional evaluation of visual fields. And so artificial intelligence used not only for diagnosis of glaucoma by visual field, if we can even have the series of visual fields to assess progression of visual field and thus thereby to find and analyze the progression of glaucoma. It can be used also by using data of structural damage in the form of OCT RNFL and RNFL ganglion cell layer. So there are multiple studies which have now been published, and a lot of work is going into using the structural parameters and analyzing by artificial intelligence. These are the series of studies which have been published for diagnosis of glaucoma using structural evaluations. Anterior segment OCT is also used of angle, where we can have various angle parameters can be assessed, like AOD 500, AOD 750, then angle recess area. All this data is captured and then sent and then can be used for assessment of angle evaluation for diagnosis of angle closure glaucoma. So hybrid artificial intelligence approaches are also made, where we combine the artificial intelligence systems, combine both the structural by OCT and functional evaluation using perimetry. And artificial approaches are also being used in glaucoma genomics. But there are challenges in the clinical translation of the tools, because the performance depends on the quality of training data. Large number of images are required, and there is good mix of ophthalmic and non-ophthalmic factors like glaucoma severity, differentiating factors from non-glaucomatous causes of optic neuropathy, the non-ophthalmic factors like age, ethnicity, race. And curating such a training set in practice is very expensive, and these are the limitations. So the future work is being done to extract knowledge independent of human intervention, such that new insights and patterns of glaucoma can be evaluated. And comprehensive artificial intelligence for glaucoma should evaluate all these parameters like structural factors like optic disc, visual field, RNFL, ganglion cell layer, IOP and gonioscopy. And that would really help if we are able to combine the structural and the functional parameters and use artificial intelligence. That would indeed be a game changer in the fight against this blinding diseases. But unfortunately, such a system is not ready yet. Thank you, everyone. And I also take this opportunity to invite all of you to the annual DOS conference, which is going to be held at New Delhi. Please kindly block your dates. These are going to be held from 7th to 9th October. Thank you once again for your kind and patient hearing. Thank you.